Breast cancer is something that has affected a lot of people, and it's likely you know someone who's battled it. That's why detection and prevention is so important, and the best way to do that is a mammogram. And Dr. Connie Jones of Solis Mammography is here, and she is going to help us today. Thanks for coming in.
Thank you for having me.
Yeah, well, this affects so many people. Let's just start with who needs a mammogram.
Well, most major organizations, regardless of their recommendations, still purport that the most lives are saved starting at age 40 getting an annual mammogram. And so our recommendation is that all women of general risk should have an annual mammogram starting at age 40. And the reason that you get a mammogram is because there are lots of things that we can see mammographically on a picture well in advance of you feeling it or having a symptom. So that's really the benefit of a mammogram, is that we can see things that are not palpable or symptomatic many years in advance. And that's the key to saving lives.
Exactly, because if you know early enough, you're going to do a lot better.
Absolutely.
Okay,
yes.
so that is key. But let's talk about Solis Mammography and what you guys do and what makes you guys different.
Well, we are very clinically oriented. One of the things that women should understand about their breast health is that a screening mammogram really can add a lot of peace of mind to your breast health, because the majority of the mammograms are actually normal, benign. So as part of your breast assessment, as part of your general health assessment, a screening mammogram is a very important part of that. The majority of women have a benign evaluation, which gives them that confidence that they are okay. If you do have a particular problem, we are subspecialty breast radiologists. This is all we do. You know, we're not reading elbows and knees. We are clinically very astute to breast issues. And so if you have a problem, you come to the right place. Again, another peace of mind with people who are doing this every day. This is our specialty. We have all the tools.
You know what to look for.
Yes.
Now, what about for people maybe who've never had a mammogram and are really nervous? Because people get really nervous.
Yes. Well, the mammogram, our technologists are very skilled at doing the pictures, and they generally are very good at relaxing the patient, even very anxious patients, for the actual study. It's a very minimal procedure. The compression is very minimal. Most women tell us that they feel, you know, the compression, but it's not painful. So for the majority of women, it's something that can be easily done within a 45-minute period.
Yeah, and we're kind of looking at the pictures and how it works now. But people are worried about discomfort. Like, should there be any pain?
Well, there can be some discomfort. Obviously, there is some compression of the breast, but the majority of the patients do not have pain. I would say discomfort to some degree in some patients. I would recommend women not do it right before their period, because that's a time when they're likely to be more tender. Usually a few days after your period would be a better time, when things are settled down a little bit. So you can time those things to make it a little better.
Now, I've heard a lot about 3D mammography. What exactly is that? How is that different? Is that something you guys do?
Yes. So 3D mammography actually gives you slices through the breast, as opposed to the 2D picture, which takes the three-dimensional breast and then puts all of that information into something that looks like a piece of paper. The 3D mammogram allows me to actually look through the breast like a CT. So as opposed to 2 or 3 pictures per breast, I may have 200 pictures per breast.
That's a huge difference.
That's a huge difference. It makes a lot of difference in terms of how comfortable I am that the result is benign, that I don't see anything. Probably about a third of the time we don't have to call women back because of that. So again, that's a very good thing for our patients.
Yeah,
that
to have the latest technology.
Right, things that aren't real don't have to be assessed, because we can do that up front with the 3D. And if there's something there, we can actually see it better. So
do we ask for that when we go to Solis?
Yes, so you should ask for the 3D mammogram.
So ask for the 3D mammogram.
So your doctor will give you the order for the screening mammogram, but you can request yourself the 3D.
Any last-minute pieces of advice for women watching right now?
I think that a lot of the media is very controversial, or say it's very controversial about screening mammograms. In the medical profession, it's not controversial.
Just do it.
The literature and the research is clear that screening mammography saves lives.
All right. Well, thank you so much for coming. I know you're an expert in this, and for more information, to visit the experts, visit solismammo.com. You see it right there on your screen, or just call the number on your screen.